Imagine in your workplace there is an accident and you are watching this person is suffering. What do you do? Are you simply standing like this? No. You have to try to reduce the suffering of the person. So what are all we do to reduce the suffering of the person is called aid. If we do medically, that is called first aid. Myself Sukumar, I am the student of occupational therapy. First aid is the initial assistance given to the victim who may suffer from injury or illness. So, first aid is the immediate care given to the victim who is suffer from illness or the injury. First aid don't need maximum skill. It just need limited skill only. Even non-professionals can also do the first aid. First aid is very useful until the professionals arrive. What is the aim of first aid? Everything has a aim, right? So this first aid has some aims. First aim is to prevent further injury. If the person is injured, so further injury should be prevented by giving first aid. In emergency cases, the aim is to preserve life and the main aim is to promote the recovery. The first aid should promote recovery, should not reduce the chance of recovery. It should promote the recovery. In all of the first aid, we should maintain the body primary function such as airway, breathing, circulation and control the bleeding. So first aid gives chance to you to preserve the life of the individual. In first aid you are doing right method to reduce the further injury or further progression of the disease and to promote the recovery. You are doing correct methods. Even knowledge in first aid also helps yourself sometimes. In first aid, some of the golden rules are there. What are the golden rules of first aid? First rule, do first thing first, quietly and quickly, which means you have to do immediately without, quietly means without panic, without fear, you have to do. Second rule, if breathing has stopped, you have to do artificial respiration. Third rule, you have to stop any bleeding by pinching the hand like this. Okay, so you have to stop bleeding because bleeding is the life threatening. Fourth, if the person is somewhere shocked like this, so you have to move the casualty gently, so as little as possible. So gently, slowly you have to move the casualty. Fifth rule, don't do maximum if the person needs minimum to save his life. You don't do maximum. If the person needs minimum, you have to do minimum. Don't do maximum for the minimum required persons. Simply don't overact. So do minimum things essential for his survival or to stop from worsening. So reassure your place is, your environment is good. So if the person is undergoing suffocation, which means he breathe unnecessary carbon monoxide like that, you have to move away from this environment. You have to re-ensure the patient as well as your surrounding and yourself also. Do not allow people to crowd because the first aid needed person is also need fresh air. So the crowd should be not founded. So you have to remove the crowd as soon as possible. Another golden rule, don't remove clothes unnecessarily. You have to remove clothes even it is only when the removal is necessary. Don't remove unnecessarily. Okay, now we discuss one criteria. So the person undergoing drowning. What is drowning? So if the person is immersed in the water, so his nose and mouth are immersed in water totally, so he may drink water as well as he breathe water and his windpipe is full of water. So his lungs also full of water, so his lungs is clogging. What is the first aid management to the drowning persons? Remove the things that are closed in the mouth and the nose areas. So like soil, mud, so seaweeds, anything else. So we have to remove those all and start artificial ventilation or artificial respiration. We can give mouth to mouth breathing or anything, any method. We have to give artificial ventilation immediately. So we have to turn the victim face down like this position and his hands should be stretched on the head like this. So this way the victim should be turned. So the water all come out. So if it is a children, you have to upside down the children. So for a shorter period to remove the waters that are all drinking. Rise or compress the middle part of the body around the belly. It will drain the water in our lungs. So if the person has stopped breathing, then you have to give artificial respiration until the breathing is recovered. It may last for 2 hours also, and we have to remove wet clothes. So keep the body warm. So make sure his body is warm by rubbing his palm and plantar region. So the body may be how warm. When victim conscious is come, so you have to give hot water, hot coffee, or hot things. So don't give cool items. So after conscious arrival, don't allow him to sit up immediately. So you have to give water and slowly, gradually you have to make him sit up. If the person is not stand up or his conscious is not arrived, you have to go to the hospital immediately. Even his consciousness is bad, you have to lift him to hospital as soon as possible to prevent further complications may be held in this situation. So correct diagnosis is needed. So we have to hospitalize the person. By this way, we are managing drowning. In many situations, we have to give first aid differently. So we will discuss further videos, more and more topics. I need support, so you have to subscribe if you can possible. Thanks for watching. Tata.